Hey guys, welcome back to my channel. Thanks so much for coming back after such a long time. I figured with all of the COVID-19 coronavirus scare that now would be the perfect time to start creating content again. So if you're new here, hi, I'm Alicia. Thanks for coming. I'm a registered nurse. I've been a nurse for 7-8 years. I recently got my master's, and I am on a mission to help educate, inspire, and empower you to make the best decisions for you and your family when it comes to health. And with this video in particular, help you make the best decisions to make a positive impact in your community.
So you may be sitting there asking yourself exactly, what is a coronavirus? Did you know that COVID-19 is just a new version of coronavirus? That's why they're calling it novel. Basically, it's the common cold. It can range from a mild cold to a more severe respiratory illness like SARS, which is severe acute respiratory syndrome, or MERS, Middle East respiratory syndrome. It can be transmitted from animals to people, which is what is suspected happened in this case. It's spread through droplet transmission or by touching a contaminated surface such as a door handle, and then you touch your eyes, your nose, or your mouth. So it's estimated that the droplets can live for up to 72 hours on hard surfaces such as plastic or stainless steel, and about 24 hours on softer surfaces such as cardboard. It's not really clear how long it can survive in cold air, and it's not known yet if it can survive in warm air. So it's best to stay up to 6 feet away from people that seem like they're sick, or in general, about 1 arm to 2 arms length away from anybody. So the symptoms for COVID-19 are pretty broad. It's a cough, fever, and that can be subjective or confirmed. So you state, I took my temp and it was 103, or you say, I feel really warm and hot. Shortness of breath. Those are the 3 key symptoms that they're noticing. And then if you feel like you're having any of these symptoms, call your doctor's office immediately. Do not go into the urgent care. Do not call 911. Do not go into the emergency room asking to be tested. Call your doctor's office. If your symptoms are more emergent, however, such as bluish lips, confusion, chest pain, extreme shortness of breath, call 911 immediately and tell them you have very emergent, concerning symptoms for the COVID-19. There are a few questions that your doctor's office will ask to kind of rule out whether you have concerning symptoms for COVID-19 or if they are more common cold or flu-like symptoms. So that would be if you've been to China or traveled within the last 14 days, if you've been in contact with anybody that you know who has traveled within the past 14 days, or been confirmed positive COVID-19 in the past 2 weeks. Your symptoms can appear 2 up to 14 days after you've been exposed. Here's a good visual representation of the differences between the influenza virus and the COVID-19 coronavirus, which, like I said before, is transmitted from animals to humans, whereas influenza can just be caused by different strains of influenza viruses. The biggest difference is COVID-19 actually can last longer as droplets in the cold air, and even when the sick person has moved on from the area, whereas the flu typically requires you to be in close contact and you get it through droplet transmission directly from the sick person. So this is why we are taking a break from large social gatherings, big social events. We're trying to minimize contact between ill people and healthy people to prevent large outbreaks of this disease. We're trying to nip it in the bud and prevent a large number of deaths, just like the flu causes. Here's another good visual representation of the current rates of infection worldwide. Now, this is globally confirmed cases. These aren't the suspected cases. As you can see, the majority of them have been mild. 57% of the patients have recovered. 40% are still sick, and only 3% have passed. And of that 3%, the majority of them have been elderly patients with chronic health conditions, not the young and the healthy. Here in the U.S., the total number of cases are at 4,226 with a total death count of 75. That is less than 2% at 1.8%. It's been found in 49 states, the District of Columbia, Puerto Rico, Guam, and the U.S. Virgin Islands. And now these are the confirmed and presumed positive cases. Those are the ones that we have ruled out any other respiratory cultures, made sure it's not the flu, and they have had positive sick contacts with those that have been tested positive for COVID-19 or have traveled within the last 14 days to a positive country. You can find updated information on the current cases in the U.S. on the CDC website. They update it Monday through Friday around noon, and so that's the most accurate way to get up-to-date information. And you might be hearing something called flattening the curve. What we're doing is practicing social distancing or self-quarantining to attempt to flatten the curve. So the curve, when you're looking at a graph, the curve is what represents the number of people who contract COVID-19 over a period of time. So the current, as our U.S. healthcare system stands right now, we have a fixed capacity, a fixed number of supplies to support all of these cases. Now we have tons and tons and tons of patients on ventilators due to the flu and other viral illnesses. And other reasons, obviously, but we don't have the capacity to take on that many more patients, to be honest. We don't have enough ventilators, we don't have enough nurses, enough physicians, enough room, enough beds to handle a huge increase and huge influx of patients. So that's what we mean by flattening the curve, by staying away from really those that you live with, or if you are a nurse or healthcare professional like myself and you have to go to work, practice social distancing as much as you can so that we can get a control on the outbreak, get a control on the numbers of cases that need to be hospitalized and on ventilators. That way we can actually take care of those that are truly sick and prevent this mass outbreak. Those that are mature adults, I don't want to say elderly, but those over 60, and especially those with chronic health conditions, so chronic high blood pressure, diabetes, chronic respiratory illnesses like COPD, and those with cancer or weakened immune systems are at highest risk for not only catching COVID-19, but having the more severe urgent cases. Children typically seem to be carriers of the virus, and of those that actually do get sick, their cases have been mild and do not seem to exhibit emergent or deadly symptoms. Those of us that are younger, healthier, have good, strong immune systems, we can fight off the disease relatively quickly with no lasting symptoms, whereas the elder population will suffer. So the whole goal of social distancing is to stop the spread, stop a major outbreak from wiping out a large chunk of our older population and keeping us all healthy and safe. Protecting yourself is relatively simple. You want to take the same precautions you would do for the flu or other viruses. Wash your hands, wash your hands, wash your hands, and quit stockpiling soap. FYI, we all need to wash our hands, okay? Hand sanitizer is appropriate if soap is not available, but if your hands are visibly dirty, they need to be washed. Stay home when you're sick. If you're concerned about flu-like symptoms or coronavirus symptoms, call your doctor's office for advice. don't go into the urgent care or emergency room or walk into your doctor's office trying to get an appointment. Self-quarantine yourself if you have COVID-19 symptoms and call your doctor's office to alert them and get further advice. Stay away from large crowds of people, which we should all be doing with this social distancing, and stay at least 6 feet away from sick people at all times. Stop buying masks, stop wearing masks. Masks are only necessary for those that have concerning symptoms, not to protect yourself when you're out in the general public. In general, pregnant women are more at risk for contracting certain viral illnesses and other sicknesses due to their lowered immune systems just from being pregnant. Data shows that they're more prone to developing other coronaviruses. However, not enough information still is known about COVID-19 and how it interferes with pregnancy. So for all my pregnant mamas, you want to practice social distancing. Make sure you keep family and friends away that are sick. Try not to go out in public in general until the concerns have been lifted. Absolutely no traveling. And I've been reading a post that's circling Facebook right now talking about how it's very traumatic to mothers and babies to separate them at birth or to restrict the number of visitors that are allowed at the hospital. And you have to remember, we are trying to keep everyone safe. Nobody wants you to have a traumatic birth experience or to have a negative birth experience. We just want to keep you and your family and your baby, your newborn baby, safe. So most hospitals are practicing one person at your bedside. That's usually your significant other to help you through your labor. Your nurses, rely on your nurses to help get through the labor process, that you have a good labor experience. And try not to live in fear. Another question that I seem to be getting a lot or see people post on social media is there a vaccine in the future? According to the Trump admin, a vaccine is currently being formulated, but it typically can take years for vaccines to go through research and development and then clinical trials to be made available to the general public. Several institutions are currently racing to develop a vaccine. However, there's a very high possibility it will not be complete before this current outbreak or pandemic is over. So by following the steps to protect yourself, washing your hands, staying away from sick people, staying away from the general public in general, are the best ways to prevent getting COVID-19. For our at-risk population, and if you remember, those are our elderly friends and those with chronic health conditions. Stay away from large amounts of people. If you do need to go out in public, stay at least 6 feet away from people exhibiting sick symptoms at all times, and try to stay at least 1 to 2 arms length away from everyone. Consider things like a mail order pharmacy or options like Instacart and Shipt for necessary grocery items. If you are at high risk and do have to go out in the general public, please consider wearing a mask when in public areas, especially when visiting places like your doctor's office. And for those of us that are healthy and able to help take care of our at-risk population, check in on your friends, ask them what they need, if they need help with groceries or really anything. Let's all stick together and help each other out. Here are a few more tips on how we can help our at-risk population. And if you remember, those are our mature adults, our elderly population over 60, and those with chronic health conditions like high blood pressure, diabetes, cancer, COPD, those kinds of things. And to my parents and my in-laws, if you're seeing this, I'm sorry, all of you are our at-risk population. So what we can do is stay away from them if we feel sick. If you feel any symptoms at all, even if it's a sore throat, stay away. We don't need to share our germs. Check in on them. Make sure they have enough food, water, and other necessities while they stay away from the general public. Have medications on hand for supportive care, such as Robitussin for cough, Vicks, VapoRub, Tylenol, NyQuil, those kind of things. And then we need to stop stockpiling necessary items so they are actually available for those that really need them day by day. We don't need 3 months worth of toilet paper and hand sanitizer and soap and water. We will get by week, okay? Here are my resources. I typically use the cdc.gov to get up-to-date information on changing facts surrounding COVID-19. And the biggest thing to remember is we need to practice social distancing. It seems like a lot of people aren't taking it seriously because they think, I'm healthy, I'm young, I could survive COVID-19. It's not going to impact me, but you could be a carrier and not even know it and pass it on to someone that you love that's older and they don't have the reserves to fight and they could pass. Or you yourself, you never know how it would affect you. So by practicing social distancing, by staying inside, by not going out and doing unnecessary shopping trips and other things, we can flatten the curve and get back to our daily routine and get back to our healthy lifestyles. If you guys have any questions, leave them below. And thanks so much for listening. Show me how to sneeze.
Achoo!
Good job. What about the other way?
Achoo!
Or like this?